Hey everybody, it's Ashley back with TravelTrim. I'm with Dr. Christopher Jones. He is an orthopedic sports medicine surgeon with the Houston Clinic, treating in Middle Tennessee. And we are here to talk about knee conditions. And I have some questions for him, and then we'll just go with the flow, see where the conversation takes us.
Perfect.
Thank you so much for being here.
Thank you for having me. Happy to talk about it.
Awesome. So tell us a little bit about yourself, where you did your training, your background, that kind of stuff.
Yeah, so I'm board certified orthopedic surgery. My subspecialty is within sports medicine. So I pretty much do mostly arthroscopic surgery, but I kind of have become this all-encompassing knee and shoulder surgeon. And I do a lot of hip preservation surgery as well. But my training is based in sports medicine. I was a resident in New York, and then I did my fellowship training in Birmingham at Andrews Sports Medicine Clinic. And I've kind of been in the South ever since. So I ended up in Tennessee.
Well, we're glad to have you.
Thank you.
And just so you know, I sent my son to him. I trust him implicitly. So great doctor. Tell us, since we're talking about knees specifically today, how common is knee pain in adults?
I think if you live long enough, everybody gets a knee problem. So it's just a matter of time. So we see it all the time. I think that even in a general orthopedic surgeon's practice, probably 60% of your patients are coming in because of knee pain.
Okay.
With a less percentage of back and shoulder problems. But knee pain is super common in the population. And I would probably venture to guess that if you live long enough, you're going to have some form of a knee issue at some point.
And do you see mostly trauma? Is it more insidious, gradual onset? What do you see?
I see a mix of that. It just sort of depends on the environment where they come from. I mean, most of the patients that kind of come into my office, I'd say, is more of a chronic issue that maybe had an acute moment where they're like, oh crap, I think I hurt something. If it's an ER follow-up, sometimes they did have an acute injury. I'd say it's probably a mix of 50-50 when it's a chronic problem or an acute injury.
Obviously, since you're a sports medicine doc, you see a lot of athletic injuries, but we'll try to keep this conversation more focused on the general adult population, maybe the weekend warrior.
Sure.
The worker, employee, those types of injuries. Concerning that population, what are the most common knee diagnoses that you see?
I think depending on the age, so I'd say under the age of 40, I would say most of your chronic weekend warrior injuries are going to be an itis, some kind of an inflammatory process, a tendon problem. If we're talking about the knee, I would say probably patella tendonitis, probably the most common just chronic wear and tear type knee injury I see in the younger patient, under the age of 50. Perhaps once you get a little bit older, it becomes more of an arthritis issue. You start to think more about do they have some kind of a cartilage problem, or is it a wear and tear sort of arthritis issue that they've just got some cartilage wearing out in the knee. But I'd say that usually it just kind of depends on how old the patient is.
Okay, so the itises.
The itises, the chronic inflammatory process.
Got it. Do you see many work-related knee injuries?
I do. I see quite a bit of that actually, and it just sort of depends on their job description. And I'd say that for the most part, the work-related knee injuries I see are acute, but we definitely have had a fair share of sort of this chronic, just nagging knee injury in a patient with a specific type of a job, where they come in and they've just had pain for a while, and now it's gotten to a point where it's just gotten worse, and they felt like they had to bring it to medical attention.
So not uncommon to have work-related knee injuries?
No, not uncommon at all.
Okay. How many of those are associated with falls?
I'd say probably from the work-related injury in general, probably about half.
Okay.
Probably about half of them, yeah.
And is it falls from slippery surfaces, or is it falls because of tripping, or is it... What kind of falls?
I would say that the majority of them are either, in my practice experience, many times a fall from a height,
okay,
or some kind of a slip and fall type injury where the footing's uneven, or a misstep off of a stair or a ladder, and you get one of those sort of injuries. But I'd say it's a mix of all of them. I can name probably a patient that's had all of those off the top of my head. It just sort of depends on the work environment and the job description.
I bring that up just to say that mind your environment and look before you leap, so to speak.
Yes.
And you can prevent
yes.
some injuries
yes.
that way.
Yes.
have you noticed that there are any commonalities, any common factors in people coming to see you with knee pain? Obviously, age, I would assume, is one of them. Are there any other factors?
I think age and in some ways inactivity. I think that a lot of the patients who maybe, they don't have the best coordination because they lack some muscle tone, or they're not super active outside of work, and perhaps that they have weakness in a certain muscle group, which make them susceptible to a fall. I think a lot of times it's probably just the patient who just kind of had an accident, but there's certainly, I think the common denominator is in some of these trips and falls, it's usually a patient that has some lack of coordination, or a lack of sort of muscle tone, where they just they just give out.
Okay.
Yeah.
What about BMI or weight? Do you see that associated with?
Yes, absolutely. I think sometimes heavier patients tend to autocorrect. And what I mean by that is they tend not to put themselves in those positions, or they, if they're heavier, they tend to be less active. So they tend to have a job where they're not getting up and moving around a lot. But there is definitely, I would say that off the top of my head, there's definitely a percentage of patients that have a weight issue, and even a subtle misstep, it may magnify an injury where if they otherwise didn't have a weight issue, they may not notice it. So you have a mild sprain of a ligament in your knee, and if you're carrying a lot of weight on there, it's going to hurt. If you're not carrying a ton of weight, you might just walk that off and you didn't think it was much at all. So,
well, what about arthritis? You said, over the age of 50, arthritic changes in the joint. There's an association with being overweight and arthritic changes in the lower extremity joints.
Mm-hmm.
And I would have assumed that that's
right. Yeah. Yeah. So
me being the wellness person, I'm going to hit on that.
Yeah. So there's no question. It's common sense and it's intuitive. If you weigh less, your knees are going to hurt less. But the real reason is, when you think about pressure on your knees, pressure is force over area. So if you have a lot of force weighing on that same area, if you're carrying a lot of weight, it's going to hurt more. And so I do think that from just a physics standpoint, having a lot of weight on a small area is going to cause some cartilage damage, and it's also going to magnify cartilage damage. I've had a fair amount of patients that they have an arthritic knee, and we know they have an arthritic knee, and they lose 20 pounds, now their pain is just gone. Or it's at a point where they're managing it so much easier, where I just don't see them anymore because they don't have an issue. But really, I mean, it's a matter of physics. If you're carrying a lot of weight on a small area, it's going to hurt.
Got it. This is a question that I get a lot. I bet you get a lot too. Is there a way to treat an arthritic knee without surgery?
Oh yeah. So I look at it, putting all the surgery aside, the non-surgical treatment, several things. The modifiable factors are the easiest things. So we talked about weight loss. Weight loss is a critical one. That's it's not the easiest necessarily, but that's probably the safest way to treat an arthritic knee. I think having generalized muscle weakness makes it worse. So you can reduce the stress across your joints by improving muscle tone around those joints. So you kind of rely less on the cartilage to stabilize things, and quadricep strength or hamstring strength or the muscle tone and coordination around the knee can help reduce the strain across the joint. So it helps. And then I think so being active, that's why I think there's a lot of basis for why physical therapy works with an arthritic knee. It really does. I mean, it just takes pressure off the joint.
Right.
It helps you get better motion, helps reduce some of the stiffness, which alleviates some of the pain involved.
Right.
I think bracing can help. It depends on the type of an arthritis that they have. Not all arthritis is equal, but sometimes if they're overloading one part of the knee versus the other, you can oftentimes unload that area with a brace, which can help a lot. I think there's different types of knee sleeves out on the market now, in addition to the bracing, which can help, and buyer's choice in terms of knee sleeves. I've got products that I like, but by and large, I definitely think that helps reduce inflammation and pain. And then I think you get into more of the injections side of things.
Okay.
The simplest being a steroid injection in the office, but there's other types of products on the market. Some of the hyaluronic acid injections have been out for 10, 15 years, and they do work well in certain cases. And then
what are those certain cases?
I think in patients that don't have very severe bone-on-bone arthritis, like when you look at their x-ray, they've got well-preserved joint space. They're not carrying a ton of weight on the knee. They tend to respond pretty well to the hyaluronic acid therapy. By the same token, I think some of the biologic injections, more specifically like platelet-rich plasma.
PRPs.
Yeah, PRP works very well. Probably better than hyaluronic acid when you look at the studies, but it works really well in patients who don't have very severe joint space loss. So they haven't lost all their cartilage. If you have bone-on-bone arthritis, admittedly, some of those injections, while they will help for the pain, they may not last a long time. Mm-hmm. So in my experience, while I'll always offer that to patients, I can sometimes counsel them like, hey, this is going to work really well for you, or this may not. Let's try other things, X, Y, and Z.
Got it. Thank you.
Yeah.
Those are, I'd forgotten to even think about bracing. But
I'm a believer in the unloader brace. I do think
Yeah.
it helps for certain things. And also, I mean, some patients have pain because the knee's a little unstable.
Right.
So sometimes you stabilize it with just an easy, like an off-the-shelf, just a low profile.
Sleeve.
Yeah, or a neoprene sleeve or like a low profile brace. It works wonders sometimes.
Yeah. It also can help control any swelling that might be happening if somebody's up on their feet all day.
Correct.
Okay. Do you have any suggestions for those that maybe have had twinges of knee pain in the past, or have family members that have had bad knees, bad arthritis, and they want to prevent that from happening? What suggestions do you have for somebody that wants to either prevent knee pain or maybe has knee pain and wants to prevent doing anything more invasive?
Yeah. So yes, I think you have to be active. So joints are a little bit different. When a joint is injured, or even when we do surgery on a joint, it wants some motion. It wants mobility. So physiologically, our bodies want our joints to move. If they don't move, it's going to hurt more. So it's sort of counterintuitive. You're having pain, while you have to immobilize it a little bit, you don't want to just do nothing. That actually makes the situation worse. So you want to be active. I think specifically, if we're talking about, say, knee arthritis, I think you need to be active. You want to obviously keep your weight down as much as you can keep your weight down. You want to probably focus more on lower impact activities if you had a hobby. So if you're a long distance ultra marathon runner, you may want to find something on your off time that's less impactful, like whether that's something in aquatic, like in the pool, something stationary bike, yoga. There's other things you can do to improve joint health aside from just running. But I do think being active is by far and away like the one counterintuitive point where I think people slip up. They just like, oh, I'm not going to do that. It hurts.
Because it hurts.
And then it gets stiffer, and then it hurts more. So it's this vicious cycle where it kind of repeats itself. So I always tell people, just be active, pick something. I'm a big fan of variability in what you do. So I think that cross training, doing something different every day of the week is better than just sort of the same activity over and over again, because I think that, let's say if all you do is just run 5 miles a day, that's great, you're running 5 miles a day, but you're going to get stiff in certain areas and it's just going to sort of pummel into itself. So you have to kind of take time to do something different.
Right.
I would love it if everybody could do 2 good leg days in the week, like in the weight room in a gym. Not everybody has access to a gym, but I think that's a great way of just like keeping everything in shape. Low impact, and then it kind of keeps your muscle strong, gets the muscle tone going, and you can kind of slow progression of arthritis that way. And then I think also some kind of an aerobic activity, mixing that in. So it's really just about being variable.
And aerobic meaning getting the heart rate up.
Correct. Yeah, getting your heart rate up, doing something that's going to make your heart rate up for 15, 20 minutes a day. Right. I think that the heart associations recommend 30 minutes a day, 3 times a week. I think that's hard for anybody, but just do something where it's elevated for some period of time, a few days a week is helpful.
And it's true. Take the stairs.
Yeah,
you can take the stairs. Take the stairs.
And I'm a big believer in activity trackers. I think that makes a big difference. Whether it's an Apple Watch or it doesn't matter what it is, just use it because it makes you self-aware of what you're doing.
Right.
And if you're not doing anything, chances are it'll tell you like, hey, you're not doing anything. Let's do something. So I think that activity trackers are a great way of doing that. I think it's one of the best inventions in the last 10 years, really.
What about supplements? We hear a lot about glucosamine, chondroitin. Do you see any benefit to that?
I think I do. So when you look at the studies on it, there's benefit to it. We think there's certainly very minimal harm in it. So I always if patients are asking me about it, they've done their homework, I'll support it. I say, yes, I think it's helpful. There really isn't much of a downside other than the cash cost that you're spending on this supplement. So I do think glucosamine chondroitin is helpful. I think in general, most people in the U.S. are deficient of vitamin D. So I always tell all my patients, you need to supplement vitamin D and calcium. Most adult recommendations is around 1,200 milligrams of calcium a day. Vitamin D, you have to be very careful in the label because sometimes if you read it, it could be 50,000 IUs a tablet. You don't want to overdose on vitamin D, but We have a big problem with vitamin D deficiency in the country, which goes beyond just joint health. It helps for wound healing and other things.
I'm gonna interrupt real quickly. This is the third doctor that we've talked about with vitamin D.
Oh yeah.
So our spine surgeon, our functional medicine doctor, and now our knee doctor, vitamin D, guys.
And the only time you'll ever hear a doctor say this, and it's me, is tanning beds are actually the best source of vitamin D is actually ultraviolet light. So it's the one time that you'll hear a doctor maybe say, like, it's not a bad idea to get a little sun 5 minutes a day. And I know some specialists in other cities actually some endocrinologists will write their patients 5 minutes in a tanning bed 3 times a week.
Yep.
Just to get that dose of vitamin D. So it's extremely important for multiple systems. It's hard to get, but the best source is ultraviolet light because your skin actually converts it into the active form. So the pills don't always get absorbed, which is tough.
Got it. So vitamin D, muy importante.
Yeah.
We talked about weight and how important it is for overall most joint health, specifically the lower extremity joints, and exercise or movement. What would you advise someone that they think that they're being active because they have to be up on their feet all day for work, but they're not really getting their heart rate up, and it's repetitive. It's the same thing. It's the same back and forth. What would you advise those people? Because I know what I would say, but they think that they're being active because they have to be on their feet at work. Is
Right.
that considered exercise?
No, I would say it's not considered exercise. So you need to do something to get the heart rate up. I do think this is where things like an activity tracker comes into play. Something that says like, hey, your heart rate, you can actually monitor it. So it's hard to lie from that. I think that you need to think of something that helps you break a sweat outside of work, 10, 15 minutes a day. That's true activity. I think, and the other way to really know is if you have some kind of activity tracker will tell you like, hey, you're not moving enough. That's probably the easiest way to do it.
And what leg exercises do you like to recommend for somebody that wants to maintain health of their knees?
Yeah, I like closed chain exercises. So that means anything where your foot is planted flat on a plate or the ground. So like a squat or a leg press where you're pushing against some other object. It gives you simultaneous contraction of several muscles around your knees. That's probably the safest way, and it doesn't overstrain your quad tendon. So if you just can look up what closed chain exercises, I love those. And also I think eccentric training is a big one. So we say work in the negative. So as you come from a full squat down, that I think is probably the best exercise in terms of strengthening true muscle. That'll give you the most bang for your buck.
And so for the average Joe, somebody that doesn't exercise a lot, you can actually do eccentric training by slowing down your squats and slowing down high steps up onto a step or something. Mm-hmm. And you're doing training in the negative, slowing things down. And it's just incredibly important for overall strength.
100%. And it's sort of like, I'm a big fan of, if you slow it down, even without weight, you'll feel it. You'll get a burn.
And you'll be sore, and that's a good thing. When someone does have knee pain, let's say not a traumatic event, but wow, my knee's really sore, and then it gradually gets worse, or before it gradually gets worse, what would you recommend for someone? Is there something that they should avoid? Is there something that they should do to keep it from swelling? Or, it's just a run-of-the-mill, it's sore, but it's not like a worked out sore.
Yeah, I think, so when it comes to knee pain, if you can walk on it, you don't have to panic about it.
Okay.
If it's so bad you can't put weight on it, then you need to come and see us. But if it's something where it's just sort of sore and achy, I think that very likely it's some version of an itis, whether it's a tendonitis or an arthritis, something's just sort of inflamed. And especially if it's chronic like that without an acute injury. So I'm a big fan of a short course of an anti-inflammatory of choice for about 2 weeks. I think the easiest thing to do for most people is I always tell them, take 2 Aleve twice a day for 2 weeks. It's the 2-2-2, and it's just easy for people to remember. Right. Even on days where you're not having pain, I would still have you take it. The way that these non-steroidal anti-inflammatories work is you need to keep them in your bloodstream for a certain period of time, because otherwise you're just chasing pain. You don't really get that therapeutic level. I think for about 2 weeks, you don't really run the risk of some of the side effects of those medicines. Mm-hmm. Now, of course, if you have a history of some stomach bleeding or some kidney issues, that's a different story, that we wouldn't push an anti-inflammatory on you. But assuming you don't have that issue, I think a short course of an anti-inflammatory for about 2 weeks works really well. I think some kind of a compression, whether it's a knee sleeve or an ACE wrap, does help a ton, especially if you have some swelling on the knee. And I think icing it, obviously, if you can ice on, 10, 15 minutes and then take a break for a few hours and ice 10, 15 minutes, that will help a ton as well. And then just sort of trying to avoid those things that make it painful. So if you're going into a deep squat every 10 minutes at your job and it's making your knee pain worse, maybe we should try and find an alternate thing to be doing. So avoidance of pain, an anti-inflammatory, some ice, and definitely some kind of a compression sleeve would help.
And so the general rule of thumb is about 2 weeks. So if you're
so.
avoiding these things for about 2 weeks and it still hurts, that's when you might want to...
I think exactly. And also, there's some studies that have come out recently when it comes to non-steroidal anti-inflammatories that if you're on them chronically, you actually get some of like a reverse effect where you don't get the benefits and now we're actually making the problem worse. So I usually tell people if it's been 2 weeks and it's not doing anything, that's kind of my go-to for like maybe come and see us. At that point, I mean, usually you need a little bit of assistance, whether it's a physical therapist or some other kind of guided exercise. So.
And if it's like, when do you recommend somebody coming in? Like you said, you can't bear weight. That's obviously one. What are some other things that people can know? I don't need to leave this for 2 weeks.
Yeah, I think if you feel a pop in the knee and it hurts like crazy, that's a problem. If the knee is really swollen, like if you can see visible swelling, then that's usually something I'd come in for. If it's bad enough where you can't put weight on it, that's a problem. So those are usually my big three. If you feel a pop or if you can't put weight on it, I'm like, okay, we probably need to at least get an x-ray, make sure you can, pop a tendon or something like that. And also, especially in terms of the knee, if you can't lift your leg up against gravity, that's also a problem. So, if you can't kind of keep the knee straight and lift up, that's something to call us about.
What about dislocations? I hear a lot of people fearful of dislocation. Oh, I think my kneecap dislocated. What are signs and symptoms of that? And when should they come see you?
So dislocations are very rare in adults. So past the age of 20 to 25, it's pretty rare that you see a first-time dislocator. So this is usually a teenage problem. But in the adult population, if you're feeling your kneecap shifting out of place, it's more likely that you've got fluid in the joint from something else. So when you have a lot of swelling in the joint, your kneecap wants to shift out to the side and it kind of has this sense of that it's out of place, when in reality, you just have so much fluid on there that you kind of feel like it's out of place. So in my experience, I think that most people that have a dislocation in adulthood, it's probably some other issue that's making you feel that way, not your kneecap coming out of place. And I think the most common I see, especially if there's an acute injury in an adult, I think a kneecap dislocation is pretty rare. It's more likely like an ACL tear or something else where your knee did shift a little bit and it's a little bit loose now and you kind of have this sensation of instability. And then the second most common thing would be, I've had patients with a lateral meniscus tear where they feel like their kneecap's coming out, but in reality it's a meniscus problem. In the patients between 20 and 30, it's more likely a meniscus issue than an actual kneecap dislocation.
And it's more traumatic?
Usually traumatic. Very, very rarely you can have a patient who has like a dislocating lateral meniscus, but those are super rare. And usually they're females in their like late teens, early 20s. So.
Okay, but you could, I would assume, go back to if it feels like the kneecap is shifting or unstable, trying the 2 weeks of what we talked about with
I think exactly. So if you feel your kneecap is unstable, I would treat it like a swollen knee. So I would do an anti-inflammatory for a couple of weeks, try a knee sleeve. After that period of time, if you just feel like, hey, something doesn't feel right, then that would be my factor or my kind of decision-making process would be come on and see somebody.
Got it. Is it common to get numbness or tingling or anything like that with knee?
It's pretty rare. I see, sometimes if you have a contusion or a bruise injury, that's probably the most common time I'll see a nerve issue specifically in the knee. Most commonly, it's referred from a low back thing.
Okay.
So someone has a pinched nerve in their lower back, they'll kind of feel it radiating into the knee. You can get something called a saphenous neuritis around the knee, which is not uncommon, but we tend to see it in post-surgical patients where they've got some irritation on one of their saphenous nerves and it's just very irritable right in that area. But I have seen some, we call it neuropraxias or a bruising of the nerve from a direct blow where you can see that. But for the most part, if a patient feels numbness at the knee, or in the leg in general, it's typically coming from their lower back.
Got it. Just talking about joint health. Do you have any nutritional advice? Outside of vitamin D, we talked about vitamin D.
So I'm a big believer in calorie counting. I think that's the easiest diet plan there is. So I think that it's shocking to people if they just look and record like what they're consuming on a daily basis. You'd be surprised how many calories you're consuming on a daily basis. So it's impressive. So I think just the fact of knowing what you're consuming is helpful for some people or most people. So when I have patients that come to me and they're worried about nutritional things or dietary things, or they're concerned about their weight, I'll just say, you know what, for a month, write down how many calories you're eating every day. And you'd be shocked. You're eating 4,000 calories a day. So that's like number one. I love calorie counting. I think that's the easiest thing you could do.
It's convicting.
Yeah, it is. I mean, and they have cell phone apps now, and they can coordinate it for you, can show you exactly how much you're consuming. But bottom line is it's a numbers game. So when it comes to weight loss and nutrition, it's calories in versus calories out. So if you're not able to burn a ton of calories, you're not being super active, at the very least you try to minimize how many you're taking in. So I'm a big believer in calorie counting. I think that there's certain things people are probably deficient in that would help. So the name of the game for weight loss is raising your metabolism a little bit. I think that daily creatine supplementation is good for people. There's some studies out there that it shows it's good for cellular health and things like that, but it does help raise your basal metabolic rate some. So I'll tell some patients, my active patient population is specifically just take like a non-flavored creatine and put it in your coffee in the morning. You won't taste it, you won't know it's there, it just helps. So creatine is a substance that helps for skeletal muscle health, and it helps promote muscle activity. So it is a way of kind of getting things going for you every day. I think that's an under talked about supplement in the general world.
Do you do it?
I do when I think about it. I do it. I like if I'm in my house and I'm drinking coffee, I'll put it in my coffee in the morning. It's an easy it's tasteless, flavorless. It's just an easy way to get it. So I'll do that. And then I think vitamin D is critical. Calcium's critical. Vitamin E is also, I think, underserved. It's good for certain connective tissues and things like that. I think that in general, just trying to have a balanced diet, high in protein as well. I think protein deficiency is a big problem, especially in active people. It's good for all body systems, whether it's your skeletal system, joint health, all those things. You need protein to build things. So if you're protein deficient, that's a problem.
What about hydration?
Yeah, so I think you can drink too much water, but it's difficult. So I always tell people, you want to have a bottle of water around you every day, like at all times of the day. Have it filled. You don't have to be chugging constantly, but I can't remember off the top of my head what the water recommendations are. But I do think, I personally try to at least have something every hour, like some kind of a bottle of water around. But I do think people are often underhydrated. If you can see color in your urine, you're probably dehydrated. Kind of a general rule. If your urine's not clear, you got a problem.
Got it. And all of that stuff will help not just your knee joints, but skeletal health, help prevent osteoporotic changes. If you were to fall, it would help prevent fracture because bone health. So, anything else that you can think of in terms of tips, tricks? What about shoes? How important is footwear for knee health?
Footwear is critical. I think what's also when I was a fellow in Birmingham, we were actually measuring incoming athletes' feet at all the SEC football programs, for example, and 80% of people had the wrong size shoe. And then on top of that, I think it was 60% of that 80% actually had different size feet, one versus the other. So I think an easy way to correct some of those issues is footwear. Make sure you're wearing the right size shoe. So those little foot measuring things, it's actually a good idea to measure your foot because you may be wearing the wrong size shoe this whole time. So I think that's really important. I think depending on the job that you do, a lot of people, if they're kind of kneeling a lot or if they're crouching a lot, you might want to have more of a rigid sole, so it doesn't put a ton of pressure on the front or the ball of your foot. But if you're sort of just sitting in a chair all day, or if you're kind of more of a walker, I think just a well-supported sneaker is probably the way to go. And something with a wide shoe box. Where you're not putting a ton of pressure on your toes.
And if somebody is wanting to walk actively or jog or whatever, how valuable do you think it is going to a place that knows footwear? And can recommend? I
think the more mileage you're putting on, the more important it becomes. There's a lot of evidence out there where, just looking at the shape of your foot. So if you're really flat-footed, you want to have something with an arch support. If you're really high arched, sometimes you may actually want to have like a little wedge under your heel to kind of help balance out the forces there. So I think it's really important for people that are putting a lot of mileage on their feet on a daily basis. So if you have a job and you're walking 3, 4, 5 miles a day, it is really critical to have good footwear. I'm a firm believer in those running stores where they can look at your feet and how you hit the ground. I think that goes a long way about injury prevention. It is good for the knees because if you have an unstable ankle or foot, it's going to weigh on your knees differently. But I do think it's super critical, especially if you have either a really flat foot or a very high arch, and especially if you put a lot of mileage on. I think there's a lot of value in those stores.
I think so too. And it's not just about how the shoe looks. And even a PT and an orthopedic surgeon, footwear changes so constantly. You need to find somebody that knows the footwear.
Yeah.
Because models change like cars.
Correct.
And just because a certain shoe was good for you last year, when it wears out, you might need a different make and model. So that's just my...
And some of those running stores are good. Like they'll look at the current tread on the bottom of your sneaker and they can kind of tell you like, you may want to go with this kind of hyperpronating shoe versus what you were wearing. This might just help you a little bit better. So they can look at how you're wearing the bottom of your shoe down too.
And like you said, you could be walking 4 and 5 miles a day at work and you still need some really good footwear.
Correct.
All right. So thank you so much for your time. It's been really informative. I appreciate it very much. Guys, Dr. Jones treats in Nashville and in...
Mostly in Nashville. A little bit in Skyline, like East Nashville area.
So if you guys need a shoulder, knee, hip preventative surgeon, he's here to take care of you. And as always, you can message us at TravelTrim. I'll be happy to answer any questions that you might have. Even I can get a question to Dr. Jones and he could probably hit me up with an answer as well. So thank you guys so much. Thank you again.
Sure. Thank you.